Dzugan Physiologic. Optimize health, optimize life. Sergey A. Dzugan, MD, PhD, a world-renowned expert in physiology and hormonal restorative therapy. Dr. Dzugan is a retired heart surgeon. He is president of iPOMS, International Physiology Optimization Medical Society. Dr. Dzugan is an academician of the International Academy of Creative Endeavors, Moscow, Russia, which is one of the top scientific honors one can receive in the international community. Dr. Dzugan is certified by the American Academy of Anti-Aging Medicine in the first group of physicians in 1998. He is a member of the Board of Editors of Neuroendocrinology Letters, a very prestigious European journal. Dr. Dzugan is a member of the Medical Advisory Board of Life Extension magazine. He is the author of several books, 146 publications in medical journals, 15 articles in healthcare magazines, and 3 inventions in cardiovascular surgery. As a world thought leader in physiologic medicine and hormonal restorative therapy, Dr. Dzugan lectures and appears to physicians and individuals around the world.
Please join me in welcoming Dr. Dzugan.
Thank you very much. Good morning, everybody. I would like to thank Dr. Toakli for the invitation to be a speaker at this seminar. It is my honor and privilege to be here. Today, we'll talk about age, what happened during aging with our body, and what we can do about it. And first of all, we need to get some general answers on a few questions, such as what is physiology? Physiology is the science of the function of living organisms and their parts. In simple, physiology explains how your body works on a daily basis. And what is health? Health is optimal physiology. And what we try to do, we try bring physiology back to medicine, because unfortunately conventional medicine is oriented strictly on drugs. And unfortunately, we forgot what we studied when we were second-year students in medical school. What can we expect during aging and why? We all started out the same. As you can see, these 2 kids have the same size of shoulders, waistline, hips, everything looks same, even the habit the same. As you can see, for some reason, these 2 beautiful kids prefer beer from Denmark. And then switch was flipping on position, and our body became different. Hormones kick in. And as you can see, different parts of the body now looks pretty different. And between age 20 and 30, we have optimal health, we have unlimited energy, we have unlimited power, and then age 40 came in. And other changes occur around this age, and as you can see, once you look down on yourself from the top and cannot see your feet, in front of your eyes only here your stomach is present, with all the problem in life here one more. Now it is crammed behind the wheel, and sex turned into sumo battle. And our hair begins to gray, and our skin begins to wrinkle, and unfortunately we have multiple problems with quality of life. We have fatigue, energy problem, we have short-term memory problem, a lot of different problems. And age 50, as you can see, life cycle completed. We look like kids again the same. Look at these 2 beautiful individuals. They have the same faces, like moon, so-called moon-like face. Definitely these two persons are under dominance of stress hormone cortisol. We have enlarged breast. We have a flabby stomach. We look the same. And what happened? Switch is in off position now. And we start to collect different aging problems, such as higher cholesterol, diabetes type 2, elevated blood pressure, depression, sleeping problem, cataract, macular degeneration, cancer, andropause, menopause, Alzheimer's disease, and Parkinson's disease. And many women after age 40 looks like these two beautiful women. This one on left side, she is pretty aggressive. She is under dominance of testosterone, and she's not taking any. And why I said this, because she is using some special weapon against husband, and she has facial hair, mustache, and she probably lost a lot of hair because she's using wig. This beautiful lady, definitely she is under dominance of cortisol, stress hormone, because she has moon-like face. But she controls her stress with margarita. And she has flabby stomach, she has droopy breast, it's problem with testosterone production and estrogen production. And this is typical man after age 40. This gentleman, his name is Japanese God of Happiness. I always, as a doctor, ask question, why he represent happiness? Because health-wise, he doesn't look pretty healthy. As you can see, he has moon-like face. Like I mentioned, it's dominance of stress hormone. He lost his hair. It's problem with production of testosterone. And what happened? Testosterone converts to stronger testosterone, dihydrotestosterone. And the dihydrotestosterone can support some sexual function, but it can give problem for hair, and it can give a prostate problem. Also, he has enlarged breast. It's estrogen dominance, and he's not taking any. And he has big Santa Claus stomach. This is problem with production of testosterone. And this is what we are looking for, and unfortunately this is what we're looking for us. And because we do not look good, we do not feel good anymore, we are going from one extreme, we try to use different type of diets, we try to lose weight, or because our brain needs glucose, because you know that glucose is #1 fuel for brain, we try to slightly overeat, so we gain a little bit weight. And you take time from your weekend, you came here because probably you try to do something with your health, and you read different healthcare magazines such as Life Extension magazine, and every time when we read article about some vitamin, we said, oh, this vitamin is good for me. You take this vitamin, then you read next article, you said, oh, this vitamin even better than previous. Then third article, and you found that this vitamin probably will fix all your problem. And in 1 year you found that your body like pharmacy, you're taking 100 pills and nothing help you. So we'll see what we can do about it. This slide just shows what happened with belt height during age. As you can see, we should hide something, so it's pretty important, remember. Then age affect, of course, our body structure. We lost a few inches of height because bone density problem, and even body appearance changed tremendously. As you can see, this gentleman, he is pretty scientific guy, and he keeps pretty good record for almost 50 years what's going on with his wife's body appearance. And this is how our monthly schedule looks like right now. We are going from X-ray, colonoscopy, to PSA test, MRI, mammogram, to cataract surgery, angiogram, and bypass surgery. Now we belong to the hospital. And what happened when we were young and happy and healthy, we had no money enough to enjoy our life. And now we have a little bit more money, but unfortunately we cannot enjoy because we do not feel good, and we decided to donate money to the hospitals. Also, it's important that, that aging affects our sex life. Afternoon we will talk about family sex problem, erectile dysfunction. And this gentleman, he is smart because he used, as you can see, jump leads attached to the young man next door, and he fixed problem with sex. But it's not funny because it's affect pretty seriously our family lives. Majority of you know this definition of aging, but I always enjoy reading. I would like to read it. I cannot see, I cannot pee. I cannot chew, I cannot screw. My God, what can I do? My memory shrinks, my hearing stinks, no sense of smell, I look like hell. My mood is bad, can you tell? My body is drooping, have trouble pooping. The golden years have come at last. The golden years can kiss my ass. Okay. This is for cat. This is for cat, not for human. Okay, now, what can we do if we want to celebrate 100 years? Definitely we need to get answer on this question, what causes disease? From our point of view, very roughly, disease can be caused by one of 4 factors: genetic and congenital, infections, trauma, And finally, acquire physiologic errors. This is any kind of error that our body acquire during aging. And any smallest mistake that our DNA and RNA did during transferring information to cells can create one mistake or one error, and this error will create another error, and then we'll have snowball numbers of mistakes, and we will get disease. And we believe that this is a category of disease addressed by restorative medicine approach. As you can see on this slide, error of physiology are the root cause of disease and affect all our organs and systems. And based on this statement, we have formulated the main principle. If you have one cause, we need to use one solution, or one disease, one treatment approach. Looks very, very simple, but we'll see how it works. We believe that method of restorative medicine is the answer for our concern, because restorative medicine treats the error of physiology by restoring the body's hormones and nutrients to optimal level. This restorative medicine approach is effective for the diseases and conditions caused by physiologic errors, because they're all basically the same disease. Very strange statement. How can heart disease be the same as migraine, arthritis or depression or Alzheimer's disease? We propose that they are all fundamentally the same because they are caused by the same problem, physiologic and hormone imbalance, including deficiencies of important vitamins and minerals. And we describe the principle of physiology optimization in this book, Your Blood Doesn't Lie. In 1996, we employ new term, hormonal restorative therapy, into our practice for the regimen that we use for our patients. And hormonal restorative therapy was defined as multi-hormonal therapy with the use of chemically identical formula for human-to-human hormones. We didn't use hormone replacement therapy. We didn't use hormone substitution therapy with drugs. We restore hormones, it's different. And the goal of hormonal restorative therapy is to restore vital forces that control the optimal physiology to treat the patient, not the illnesses that have befallen them. The key word is patient. We never try to catch dragon tails. We try to squeeze his neck. This slide just shows what happened with hormonal production such as DHEA or dehydroepiandrosterone and testosterone during aging. This is different aging groups. And as you can see, after age 50, DHEA level decreases by more than 70% from its peak values between age 20 and 30. What happens if your body cannot produce 70% of insulin? You'll go to your doctor will give you insulin. What will happen if your body cannot produce 70% thyroid? You'll go to your doctor and he will give you thyroid. What will happen if your body cannot produce 70% of testosterone? Again, you will go to your doctor and doctor will give you what? No, Viagra. So, as you can see, from endocrinological point of view, it has no any sense. So we need to be careful what we do for our patients. We must remember that bioidentical hormones, not synthetic drugs. I will try to explain a simple way. This is a picture of molecule of natural hormone progesterone, so-called female hormone, but male's body produce progesterone, female's body produce testosterone. We are human beings. We have same hormones, only our body produce different amount. And this is drug that look like progesterone, but it doesn't behave like progesterone, and it has different effect. And I will try to explain you a simple way for understanding what difference between drug and natural hormone. When you're thirsty, what you need? Water. Absolutely clear. This smart guy said, I will put in 2 glasses, one vodka, another water. Drink it, don't smell it. I guarantee in the morning you will see different effect of these 2 similar fluids. And this is the same situation with any kind of so-called synthetic progesterone or so-called progestins and progesterone. Again, the biggest mistake when patients want to improve, for example, erectile dysfunction or hot flashes, you came to your doctor and doctor gave to you testosterone or gives to you just estrogen. Big mistake. Our body produces many hormones, and unfortunately, whatever we do, after age 35 approximately, 40, majority of people have an imbalance of different hormones. That's why we have major problems such as elevation blood pressure, arrhythmias, insomnia, fibroids, fibrocystic breast, cancer, and other issues because imbalances. So we always need to look for several basic hormones such as pregnenolone, dehydroepiandrosterone, estrogens, progesterone, testosterone, thyroid hormone, melatonin, hydrocortisone, and aldosterone. And nothing can be done blindly. Big mistake. You cannot go Walmart and buy glasses what you like if you have vision problem. You need to go to your eye doctor. He will check your vision and will recommend exactly glasses what you need. That's why we always check for basic hormones that are shown on this slide, and we always check for serotonin. Serotonin is an extremely important neurotransmitter for mental health, and more than 50 million Americans take antidepressants, and majority of them work on serotonin. And unfortunately, I didn't see one single doctor since 1996 who did serotonin test for patients who were placed on drugs for depression. And quite often when we check serotonin levels, serotonin was 0. So it's same thing like we have electrical wires and no electricity. This slide just shows what difference between conventional medicine and physiologic medicine that we use. Conventional medicine use single model approach. We use Crestor or Lipitor for elevated cholesterol. We use Zoloft for depression, Fosamax for bone density, Viagra for erectile dysfunction, Ambien for sleep. When we talk about physiologic medicine, we use so-called multimodal approach. We use many different hormones, vitamins, and supplements at the same time for elevated cholesterol. We use many of them for depression. We use many of them for bone density problem. We use many of them for erectile dysfunction. And we always must keep question in our mind, what we are deficient in. We have problem with production of testosterone, or we have problem with production of Viagra. And when you ask this question, it's clear that your body produces testosterone. When we talk about single modal versus multimodal approach, it is simple as 4 flat tires. And a few slides explain these rules, flat tires rules. If you have deficiency of 4 hormones, estrogens, testosterone, DHA, progesterone, and you replace Restore 1, you cannot drive, Restore 2 cannot drive, Restore 3 maybe, but when you restore all, it's the best situation, and balance physiology, your body works like this beautiful car, Ferrari. Now let's see what is clinical application of physiology optimization for major diseases? And of course, number one problem, cholesterol. Everybody's scared cholesterol. So I will try to confuse you today, and you have book, you will be confused even more after reading. Before I will talk about cholesterol, I would like to remind you what is medicine. The word medicine originated from Latin, ars medicina, and means an art of healing. And unfortunately, in the modern world, medicine is an art of business. And unfortunately, medicine became a science with a heavy involvement of statistics. It is not an art of healing anymore. And you know that there are 3 lies: lie, damn lie, and statistic. And every time when we do not like results, when we try to introduce new drug, we use statistics, then FDA loves results, and then we can use drugs for our patients. What is cholesterol? Unfortunately, your doctor told you only bad things about cholesterol, but I would like to remind you that cholesterol is absolutely essential for life. It is found in all cells of the body. Our body produces cholesterol more than any agents. And patients who have low level of cholesterol, they have usually huge life problem. Number one problem, mental health, depression, suicides, criminal behavior, alcohol abuse, drug abuse, infertility, miscarriages. 75% of kids with autism have low level of cholesterol. Patients in young age who have so-called solid cancer, like lung cancer or pancreatic cancer, they usually have low cholesterol. And why is that? Because cholesterol is major building block from which cells membrane made and used to make a number of important substances such as steroid hormones, bile acids in conjunction with sunlight, vitamin D3. Steroid hormones play extremely powerful, important role in our immune system. And when our immune system weak, we have multiple problems. look this number, 25% of cholesterol is localized in the brain. And why? Because we have barrier between blood-brain barrier, and our brain needs to produce cholesterol because, again, cholesterol is important for production of steroidal hormones. And our brain uses all these hormones for normal brain function. This is a very simplified version of metabolism of cholesterol. Cholesterol on the top. As you can see, our body normally uses over 60 steroids derived from cholesterol. Like I said, it's a very simplified version. But your doctor didn't tell you that you need cholesterol for production of testosterone. That's why many patients who use cholesterol-lowering drugs, they suppress cholesterol, they suppress production of testosterone. So many patients who are on these drugs, they have erectile dysfunction. What happened during aging? Production of hormones start to decline. What your body tries to do? Your body tries to produce or provide more building blocks, cholesterol. Your cholesterol level elevates, but unfortunately during age, our enzymes that control conversion of cholesterol to hormones and interconversion between hormones do not work anymore well. But this is the same situation like what happened during pregnancy. During pregnancy, cholesterol level elevates up to 300, 350, 400. And no single doctor treats pregnant women by any cholesterol-lowering drugs. And why? Because pregnant woman needs much more building blocks and hormones for two, for baby and herself. And we know that if you'll give any cholesterol-lowering drugs, we'll kill baby. So it's very dangerous. We can be sued. What will happen if you'll restore useful level of hormones? There is no reason for production of cholesterol. And this is what we did. In 2002, we published article in Medical Hypothesis in England, where we suggested new hypothesis that high cholesterol is compensatory mechanism for decline production of steroidal hormones. And when you restore useful level of hormones, your cholesterol level usually decline. We must remember that cholesterol is our body thermostat. It's same thing like when you have fever. Fever just tells you that you have infection, germs and viruses. And you will not try just suppress body temperature because you can get pneumonia because germs cannot survive in elevated body temperature. What elevated cholesterol tells you that you have some problem with production of hormones, so you have many damages. So be careful with this. Many women who have hysterectomies, they have organ that cry with blood and tells doctor, I have pretty bad imbalances. I have crying organ with blood. Help me. You came to gynecologist said, oh, you have complainer, hysterectomy. You remove basically best marker that you have problem, and what will happen next? You didn't fix underlying cause of this problem, and next what you can expect expect severe problems such as breast cancer, for example. Little bit more confusion. How we measure total cholesterol? Total cholesterol equal a good cholesterol, HDL, plus bad cholesterol, LDL, and plus triglycerides divide 5. Now I will not talk as a lay person. I will talk as heart surgeon and PhD in this field. What about molecule of cholesterol? Cholesterol is a very unique molecule. It's not fat, it's not lipid, it's not protein, it's not carb. It looks like alcohol, but doesn't behave like alcohol. What about HDL, good cholesterol? It's not cholesterol. It's lipoprotein. It's combination of lipid and protein. What about LDL, bad cholesterol? It's not cholesterol. It's a carrier. It's lipoprotein. What about triglycerides? Triglycerides is fat. So you can ask simple question, your kids or grandkids, how many apples cholesterol you will get if you will add 35 pineapples plus 130 pears plus 150 peaches divided 5. According to this calculation, 195 apples. So it has no any sense. That's why I said this formula provides an approximation. And why I said this? Because when we talk about this HDL, bad and good cholesterol, they are carriers like UPS truck. They carry cholesterol ester, triglycerides, phospholipids, and protein. But maybe truck's empty. What we know number of these carriers. So we got some information that tells us something wrong. We need to look what is going on with your body. I love this statement. Dr. Miller from Ohio works for several years for us, and he said nicely about cholesterol-lowering drug statins. As it relates to cholesterol, most physicians feel that everyone over the age of 50 has a suffering from acute lipid orthocork deficiency. We are measuring their own sin, we treat with their own medicine, statins are toxic, and we wonder why a large number of people are still dropping over dead with heart attack. This is typical case study, 61 years female with higher cholesterol, depression, insomnia, arthritis, constipation. She has much more problem here. Her initial cholesterol was 278. She had not detectable DHEA level, not optimal pregnenolone, low level estrogen, low level progesterone, low level testosterone. When we restore or optimize level of hormones, what happened? Her total cholesterol, triglycerides, HDL, LDL, VLDL decrease, and she had no complaints here. Why do we need a new method for a treatment of cholesterol? Because everything about life and death. And we know that taking potent cholesterol-lowering medications has never been shown in clinical research to actually improve mortality. In fact, in the biggest trials, significantly more people who took drugs died than those who did not. They didn't die of heart attack, but death is death, whatever the cause. Okay, now a few words about headache from the hell, migraine. I published this book in 2006. At this time, I work in a Life Extension Foundation. I was president of Scientific Information, Inc., and we treat 1,000 people from around the world with pretty good results. And from our point of view, migraine is a very complex disorder in several systems and requires multimodal treatment program. I will not take your time, and I will not go in detail about this, but I will show some case studies. 58 years female. She had high cholesterol, 300, migraine for 38 years, chronic fatigue syndrome, depression, insomnia, and more problems. And she had daily migraines when she came to us. She had undetectable level of pregnenolone, low level DHEA, low level of estradiol, low level progesterone, not bad level of testosterone. When we optimize her hormones, and of course we use different supplements and vitamins. When I talk about hormones, it's not our program. It's not just hormones, because hormones extremely powerful part of the program, but we always must remember that our testosterone can convert to dihydrotestosterone, our testosterone can convert to estradiol, so we need to work with all this physiological interconversion, so we need to use different vitamins and supplements. And this nice lady, she will talk about her situation.
Hi, my name is Linda. I've been on Dr. Dzugan's program for over 4 years. I found him originally in my 16-year quest to cure my chronic health problems. I had suffered from daily migraine headaches, fibromyalgia, anxiety, depression, gastro problems, gynecological problems, significant hair loss. And I had tried everything that both conventional medicine and holistic medicine had to offer. In fact, I spent over $50,000 looking for a cure, and I continued to get sicker and sicker. And the answer to my prayers was I stumbled upon Dr. Dzugan's first book called The Migraine Cure. I read it, and it made a lot of sense to me. It was the first time anyone had really talked about balancing the hormones. And I had read every other migraine book out there, but this was so different that I was hopeful that this was going to help me. So sure enough, I started this program, and within just a couple of days I felt some changes in my body, and I felt cautiously optimistic that this could be what I had been searching for so many years. And sure enough, as the time went by, as the weeks and months went by, I started feeling better. I'd say within 6 months I was 50% better. Which in my mind, what that meant was I would go to bed at night and not have a migraine 50% of the time. And if I'd never gotten better beyond that, I would have been forever grateful. But what happened was I continued to improve. And by the year anniversary on my program, I was probably 90% better, pain-free. And again, it wasn't just the headaches that were improved. It was the all-over body pain with the fibromyalgia. The depression and anxiety lifted almost immediately. The gynecological problems. I mean, everything just got better. I used to spend my life running from doctor to doctor for all these different problems, which turns out really all had the same root cause. It was a hormonal imbalance. My body was just not capable of producing the level of hormone needed to accomplish all these functions. So once I replaced the hormones, along with these other vitamins and supplements, in a ratios customized for my body based on lab results, I got better. So I guess I love to tell my story to people and give them hope that if you feel like you've tried everything, please try this. And more than anything, I just want to say thank you to Dr. Dzugan, because I get emotional, but he really did change my life. I was pretty close to giving up, and he gave me my life back. And words are not sufficient for the gratitude that I feel every day. So sorry for getting emotional, but I'm a different person today because of him and his program. So thank you.
Dzugan Physiologic. Optimize health, optimize life.
Okay, and Linda is here. Linda, please wave your hand. Okay, now a few words about non-small cell lung cancer. Non-small cell lung cancer is #1 cancer killer. I worked for 7 years in private cancer clinic, and we had some crazy results, so I would like to share with you very quickly what we did. This type of cancer, if you have metastatic form or two-side lung cancer, usually kill quickly, and we have only 2% 5-year survival rate. 98% people died during 5 years. We had 11.1%. It's not higher number, but it's 5.5 times higher than majority of clinics from around the world have. And what we did differently, we use additional to surgery and radiation therapy, so-called immunorestorative therapy, that include hormonal restorative therapy, antioxidant therapy, correction of protein malfunction, and we use different agents that increase production of natural killer cells. Normal range for natural killer cells from 3 to 15%, and many of our patients had 40, 50, and maximum that I remember, one woman had 72% of natural killer cells production. In other words, her immune system works extremely well. And this typical case study, 80 years old male with two-side cancer, left side lung cancer and right side lung cancer. He survived more than 5 years. Yes, of course, we didn't use chemotherapy because we know that this chemotherapy never works and probably never will work for this type of cancer, and definitely will kill immune system and patient. And there is no evidence of cancer after 5 years. There is a lot of talk about diabetic damage of vision. This is a picture of left eye, and this is right eye. Center responsible for 20/20 vision. And as you can see, right eye has damage by diabetes and no 20/20 vision anymore. And this woman, she received in May 2010 laser treatment to right eye. And unfortunately, in August, her eye became blind. And her doctor said that she may need Avastin, direct injections to eye, or another focal laser. And she decided to try physiology optimization with restorative medicine. And this is January 2011. As you can see, 20/20 vision was restored, and this era of clarification. And a doctor said, good news, no need for anything, see you in 6 months. I do not try to tell you that we can cure everything or improve everything. What I'm trying to say that when we do not interfere with our body ability to heal and we help, we can get some very crazy anecdotes or results like I demonstrated before. Now I would like to show 4 slides that will demonstrate importance of blood testing for different aging groups. This boy, 6 years old boy, had severe attention deficit hyperactivity disorder. His doctor wanted to place him on Ritalin and antidepressants. Father hates Ritalin because he works in my department, Life Extension Foundation, and he knows that Ritalin can decrease physical development of child, and he does not want to do this. And when we did blood tests, we revealed that his cholesterol was on low side If you have low production of cholesterol, you have low production of your basic hormones. And blood tests confirmed that he had non-detectable level of DHEA, not detectable level of estradiol, not optimal level of pregnenolone and progesterone, and absolutely normal level of testosterone. And we made conclusion that there are no cooling, calming effect on testosterone there in matter of aggression, hyperactivity. Child is happy. He's running, destroy everything because he has accelerator and he has no brake. 27 years old female. I always, when our patients start program, we refuse to do program if they use birth control pills. A majority of gynecologists said it's safe, no problem, but we saw again, every time when we do, for example, tests for young women who on birth control pills and grandmother always has better hormones. And this typical case study, she had debilitating daily migraine for more than 4 years, depression, extreme fatigue, low blood pressure, and insomnia. She was taking a lot of drugs plus birth control. She used a lot of supplements for migraine. But look what's going on with hormones. DHA 25, it should be optimal more than 250. Pregnenolone level 7, it should be more than 160. No estrogen, no progesterone, no testosterone, low level of serotonin. Yes, of course, she will have all this problem, but nobody looked for this. Low level of cholesterol, 112. 35 years old male, low cholesterol, fatigue, very poor stress control, irritability, anxiety, short-term memory problem, low libido, frequent infection. DHA should be more than 500. Pregnenolone should be more than 160. Progesterone should be around 1. Cholesterol should be, cortisol should be more than 16. And only testosterone was normal. Yes, of course, he will have all these problems in spite of he is 65 only. 71 years old female. Coronary heart disease, bypass in very young age, high cholesterol, surgical menopause. She had fibroids in 1987, mastectomy because fibrocystic disease, depression, arthritis, insomnia, fatigue. Her body doesn't produce DHA, doesn't produce pregnenolone, no progesterone, no testosterone, no cortisol, and just a little bit estrogen. As soon as her body will decrease production of estrogen, she will die. 2004, this man, he got death sentence, 2 years to live from cardiologist. He was on 18 drugs. He was at this time in 2004, 61 years old. He had congestive heart failure, high cholesterol, high blood pressure, diabetes type 2. He had leukemia, blood cancer. White blood cells was 60,000. Erectile dysfunction, obesity to 80 pounds. PSA was 18. It should be less than 4. Depression, fatigue, insomnia, short-term memory problems. 2010, dramatic improvement, almost 100 pounds drop. PSA, in spite of use testosterone, DHA, decreased from 18 to 7. White blood cells decreased to 17,000 from 60, and no drugs at this time. And this is 2012.
Actually, I can't even tell you how I feel. I feel so good. I can't even remember how bad I felt. But I was always a diabetic. 7 years ago, they detected me as having an inoperable heart, coronary heart disease. I also have leukemia, issues with my prostate. I was on close to 18 prescription pills. I had fatigue, low libido, very tired all the time. I just couldn't do anything. And when they told me at a renowned, well-known hospital in Cleveland that I had the coronary heart disease, that they gave me 2 years to live, it was really a shock to my system. Mentally, first thing that came into my mind, what am I going to do? I got depressed, my family, I tried to get things in order and never going to see my grandchildren or be able to spend some time with my grandchildren. And so my son told me about this program with Dr. Dzugan, And he says, Dad, why don't you look into talking to Dr. Dzugan and looking into his program? I think you would really be surprised. And I started talking to Dr. Dzugan and one of the doctors in my local area. And I said, you know, this sounds pretty interesting. So I got on it, being a little bit pessimistic about it. And next thing you know, a week goes by and all of a sudden I start feeling better. I mean, I was so used to taking 3-4 nitros just to keep me alive because of all the chest pains and everything I had. Going to my oncologist and going to my family doctor and going to my heart specialist and everybody telling me all these negative things, and all of a sudden they're telling me, boy, you're doing a good job, boy, you're looking good. I started losing weight. I actually had a lot of energy to want to go and work out, and I started doing the treadmill. I do the treadmill 18 miles an hour, 18 miles a week. I work out with a trainer, and actually I feel like I can run a marathon. I feel so good, and I mean, it's unbelievable. I can't believe how well I feel. I feel so good, it actually scares me. It scares me so much that I feel so good. And basically I want to thank Dr. Dzugan and especially my son for finding Dr. Dzugan. And basically that's it. And thank you very much, and I'm glad that I'm still here to enjoy my family.
Dzugan Physiologic. Optimize health, optimize life.
And Jimmy is here. Jimmy, please wave your hand. Okay, now Jimmy's son, Michael, 29 years old, in 2009. He had anxiety, arthritis, fatigue, obesity, weight 283 pounds. He had low DHEA, low pregnenolone, higher estrogen, slightly elevated progesterone, extremely low level of testosterone. He had the same level as his father had, and not optimal level of cortisol. And this is 2012. He lost 77 pounds. Michael, he's here. He hides himself, yeah. You know that when we have deal with any autoimmune disease such as scleroderma or rheumatoid arthritis or any kind of autoimmune disease, we try to suppress immune system. And what we try to do in such cases, we try to restore immune system. And you will hear a testimonial of a doctor who works with us with very unusual skin disorder.
This was a lady, a patient of mine for many, many years, was a good friend, and she had given me permission to go ahead and share this with the people. But she had, over the time, had developed an allergy to her skin. And she developed sores, much worse looking than this actually, on her legs, on her arms, on her stomach, and her hands were cracked and bleeding. She had to wear cotton gloves all the while because she couldn't touch anything. And she finally came in to me a little over a year ago and said, I can't live like this anymore. And so I sent her down to Shands to see if they could give us any answers. And they spent about 6 months doing all kinds of tests and probing and poking and putting her on steroids and prednisone and all that stuff. And a little bit of sores weren't quite so bad, but still itching and feeling miserable. And they finally said to her last summer, well, the only thing we have to offer you is cyclosporin. Cyclosporin is a drug that we give to transplant patients to prevent rejection. It kills your immune system, basically. Well, she was very wise. She went on did some research, came in and said to me, I'm scared of this stuff. And I said, yeah, me too. And I said, I've been learning about this process. I haven't had anybody with this specific problem yet, so I don't know if it will work, but I think it's worth a try. And so she got into the system, did her history, and got all the lab work. It's very extensive lab work that they do, and had her program designed. She started that the 3rd week of September. The 2nd week of November, she came into my office, gave me a big hug, and shook my hand. I knew something was better right away because she shook my hand. The only thing she had left of all of those lesions was a little rough patch on her hand and a little crack on her finger right there. And actually, she was at a seminar that we just did last night, and still, even actually those have since resolved. And so, of course, she is thrilled. She brought a couple of her friends along to learn about all this process. But it was an amazing example of a very complex system, the immune system, which if you really talk to anybody, nobody knows how it really works. It's just extremely complex. But it responded to correcting the errors of metabolism and physiology. And so that now she now has a very healthy immune system that only attacks the things it's supposed to attack and not attack her skin and other organs in her body.
I would like to stress one more time that we didn't do anything differently in all these cases, cholesterol or cancer or migraine or congestive heart failure. What we do, we restore body foundation. We optimize physiology. Programs were very individualized. We used different agents that look similar, but again, we didn't do anything that interfere with body ability to fight with problems. Impossible claims, snake oils, cure souls. We must have appropriate expectations. Definitely, it's not a magic aesthetic miracle. We are not trying to turn you into a Terminator, and definitely we cannot go from this condition to this. It's different things. What we try to do, we try give you enjoyment of life as you did before. And it's me 15 years ago. Unfortunately, long surgeries did a lot of damage to my spine, so I always walk like this gentleman. I had problem with short-term memory, and when I did lecture for students, I didn't remember what I need to talk about, elevated cholesterol and high blood pressure, of course. And this 15 years later, as you can see, I have much more gray hair, but it looks like I am talking for you for 44 minutes, and I do not need to look what I need to talk about. And this Mona Lisa, just 1 week in US before and after, as you can see, she got quick improvement. And we must remember a few things. We will all die. But I want to die while sleeping like my grandfather, not screaming in terror like the passengers in his car. And second, cherish your health. If it is good, preserve it. If it is unstable, improve it. If it is beyond what you can improve, just get help. Thank you very much for your attention.
Dzugan Physiologic. Optimize health, optimize life.